Hi, welcome to the Dental Surgery, your home for dentistry. Today we're going to be talking about toothbrushing techniques. I'm going to be showing you some demonstrations on some models. It's not a substitute for an actual clinical demonstration, but it'll give you an idea of what you should be doing. We all brush our teeth, we've been doing it since we were kids, but are we doing it effectively? The reason we're brushing our teeth is to remove bacteria from the teeth and the gums. It's not just about fresh breath. Good brushing technique is a good tool to help prevent gum disease and tooth decay. Brushing with a manual toothbrush, you want to choose a toothbrush that's not too big for your mouth, okay? These slimline brushes are great. And what you want to make sure you're doing is having a pattern. To start with, maybe at the back, brush all the outsides of the teeth, the insides, and then the tops, and repeat that on the top. You want to make sure you're brushing the gums. This is the most important thing to do. When you hold the brush, you want to brush 45 degrees to the gum line. Now you can move the brush in small little mini circles all around like this, or you can move side to side. It's really important that you don't scrub. You don't want to be doing this. It's not effective and it can cause gum recession. Once you've got a nice routine going round and round, you make sure you're doing all the front surfaces till you get to the back. Just one or two teeth at a time, nice and gently, but thorough. Now on the inside, this is where it's a bit trickier because the tongue lies here. Use the brush round and round or side to side to make sure the gums and the teeth are getting cleaned. As you come further forward, brush upwards like this. Make sure that brush is contacting the teeth. Sometimes people brush like this, they brush like that. You need to make sure it's all along the teeth and the gums. Come back round to reach those back teeth. Now plaque tends to build up a little bit more around the back, so you need to make sure you're putting some effort to get back there. Once you've done the fronts, the insides, give the biting surfaces a good clean. You can scrub a little harder on these. Okay, then you want to do the tops. Again, start right at the back, little mini circles or side to side motions, nice and gentle on the gums and the teeth all around. You can see it's quite a controlled, relaxed method, not brushing hard and not brushing too fast. Okay, you want to repeat that on the insides of the teeth. So for the tops and the insides, you're brushing, you should feel the bristles tickling that palate as you're coming around, making sure every tooth is brushed. You're not missing any out in the end. And then don't forget the biting surfaces. Make sure they're brushed as well. Okay, not everyone's teeth are like this. Some teeth are more like this. Okay, if you have crowded teeth, it's a little bit more difficult. If you have wisdom teeth, you might need to spend a little bit longer brushing. You want to spend 2 minutes brushing with a manual toothbrush. If it doesn't have a timer, you need to time yourself. 2 minutes is longer than what you think it is. If you have wisdom teeth, then sometimes you just need to spend that little bit more time back there. If you have crowded teeth at the front, a little bit more time along there. Okay, you can also get these little interspace brushes that helps with this, clean around wisdom teeth and clean in difficult areas. If the teeth are inclined a little, these are great to do after you've done your brushing with this. So you should be brushing twice a day for 2 minutes at a time. When your toothbrush is looking frayed, you need to change it. Normally this will last 3 months. We advise changing your toothbrush every 3 months. A toothbrush that looks like this and like this is not going to clean your mouth very well. Please change every 3 months to keep brushing well. So now I'm going to show you how to use an electric toothbrush. These are really good, especially for cleaning molars, wisdom teeth, difficult to clean areas. The brush does the work for you. You have to use it right though. So I'm going to show you how to position it. Really easy. You pop it right at the back, start at the back just like you would with a manual toothbrush. You pop the brush on. I'm not going to put it on at the moment, but you can see just holding it, it will do the work like that. Okay, so you're moving it all around, keeping it in good contact with the tooth and the gum, letting it do the work. It's rotating, it's oscillating, it's cleaning in between, around the gum line, okay? Once you get to the end, you need to repeat the same on the inside. This is where it's a little bit easier than a manual toothbrush because you don't need to move it. It's doing the work, so you don't have to, okay? Keep it in good position all along and then do the biting surfaces as well. Same for the top teeth, you're holding the brush up to the gum and follow it round. You do not do this. You don't use it like a manual toothbrush. It doesn't work as well. You need to hold it gradually, gently, move it around. If you start scrubbing too hard with this brush, you will get a flashing light. Generally, we recommend you getting the electric toothbrush with a 2-minute timer and a pressure sensor at the back. I'll show you just how that works. Okay, you can see that there. I start to scrub, the light comes on. You want to be a lot more gentle. This is great for receding gums, just to prevent you from overbrushing and not being as effective. Great thing with the Oral-B brushes, they all have indicator bristles. The blue bristles on them will fade when you need to change your brush. One here, this is one of the sensitive heads that is faded. The bristles are splayed out. This toothbrush is not going to clean your mouth very well. You change it for a brand new one about every 3 months. As you can see with the manual brush and the electric toothbrush, we're cleaning the fronts, the inside, the tops. They do not clean in between. You need to floss or use interdental brushes there as well. A good thorough brushing technique, cleaning in between, brushing your tongue will keep your mouth nice and healthy. Hope this has brought you a bit closer to your TDS smile. If you have any other questions about your routine, just drop us an email on the link below. Thank you for watching.